Restless leg syndrome is an uncomfortable sensation in the legs, leading to an urge to move them, especially during periods of inactivity or rest. To alleviate this discomfort, people with restless leg syndrome often get up to walk around, finding that movement significantly eases their symptoms. They might also stretch their legs, flex their feet, or frequently shift their leg positions for relief. Restless leg syndrome commonly affects middle-aged individuals, with the risk increasing as people age. It is rare in children but possible. In children, restless leg syndrome sometimes appears alongside attention deficit hyperactivity disorder. The condition is twice as prevalent in women than in men. Around 5 to 10% of the global population is affected, making it a common disorder. Most cases are chronic, requiring lifelong treatment, though approximately 20% can be temporary and resolve after some time. Symptoms of restless leg syndrome worsen at night and during periods of sitting or resting. One of the key characteristics of restless leg syndrome is sleep problems and daytime fatigue. Severe restless leg syndrome often leads to significant sleep deprivation, which increases the risk of cardiovascular diseases and stroke. Additionally, restless leg syndrome is highly correlated with obesity, metabolic syndrome, and diabetes. Some individuals with restless leg syndrome experience cognitive problems such as issues with memory, focus, and decision-making, likely due to dopamine deficiency and sleep deprivation. Most cases of restless leg syndrome have a genetic basis, often linked to hereditary genetic mutations. However, about 20% of cases are caused by iron deficiency and can be resolved with iron supplements. Chronic kidney disease, diabetes, and peripheral neuropathy also increase the risk of restless leg syndrome. Certain medications, including antidepressants, antipsychotics, and antihistamines, can trigger or exacerbate the condition. Restless leg syndrome, RLS, also affects around 10% of pregnant women. In these cases, the condition is usually transient and often resolves within several weeks after delivery. The central mechanism behind RLS is believed to be a deficiency of dopamine in neurons responsible for coordinating smooth voluntary movements. This deficiency can be exacerbated by hormones such as estrogen and progesterone, which decrease dopamine synthesis, explaining why RLS is more common in women and during pregnancy. Iron deficiency is also significant because iron is crucial for dopamine synthesis, and its deficiency can contribute to RLS. It's important to differentiate RLS from conditions that can mimic its symptoms. For example, habitual tapping, like a student tapping their leg during a lecture, is usually not RLS. The main difference is that in RLS, there is a compelling discomfort that is relieved by movement, whereas habitual tapping is often due to boredom or anxiety. Parkinson's disease can also mimic RLS, but it typically starts with noticeable hand movements rather than leg movements. Treatment and management of restless leg syndrome. Lifestyle adjustments. Exercise. Regular, moderate intensity exercise for at least 30 minutes daily is recommended. However, avoid very intense exercise and ensure there is a 4-hour buffer between exercise and sleep to prevent worsening symptoms. Sleep hygiene. Maintain a regular sleep schedule and create a comfortable sleeping environment. Avoiding triggers. Reduce intake of substances that can exacerbate RLS, such as caffeine, alcohol, and nicotine. Nutritional interventions. Iron supplementation. If iron deficiency is identified, iron supplements, oral or intravenous, can be very effective. It's crucial to monitor iron levels to avoid excessive intake, which can be harmful. Medications. Dopamine agonists. Medications like pramipexole and ropinirole, which mimic the effects of dopamine, are often used as first-line treatments. These are typically taken daily, usually in the evening or at bedtime, to address symptoms that worsen at night or start earlier in the day. Monitoring for side effects. Long-term use of dopamine agonists can lead to impulse control disorders, such as compulsive gambling, shopping, eating, or hypersexuality. Patients using these medications should be regularly monitored for these behaviors. The treatment of RLS is usually long-term. And another significant challenge is augmentation. Which means, symptoms may worsen despite treatment, or symptoms occur earlier during the day than before. At this case, dopamine agonists are replaced, usually with alpha-2 delta calcium channel ligands. Gabapentin and pregabalin. These medications are effective in reducing sensory symptoms and discomfort associated with ILS. Second-line treatments. Benzodiazepines. These can help improve sleep quality but are generally used with caution due to the risk of dependence. Opioids. Medications like oxycodone and methadone may be used for severe cases, but due to the risk of addiction, they are considered a last resort. Alternative therapies. Compression devices. External pressure from these devices can help reduce symptoms and are recommended for patients who cannot tolerate dopamine agonists or who have experienced augmentation. Magnesium can help alleviate symptoms by improving muscle function and nerve conduction. Vitamin B12, effective in cases where there is an overlap of ILS and neuropathy. Non-pharmacological interventions. Physical therapies. Leg massages and stretching exercises. Regular massages and stretching can help relax muscles and reduce discomfort. Acupuncture. This can be beneficial if performed by a qualified acupuncturist.